platelet-rich plasma therapies, with indications for use in a variety of surgeries and in facial skin rejuvenation. The basis for PRP therapies is whole blood, and in whole blood you find a lot of cellular mass, including leukocytes, erythrocytes and platelets. All the blood components have a variety of functions like the leukocytes and red blood cells. Platelets are known for their blood clotting activities, and they are less known for their wound healing capacities. In the last decade, a variety of publications have been published with regard to PRP or platelet gel indications for a variety of surgical procedures. In recent years, platelet-rich plasma and platelet gel technologies have shown great promise, and positive results have been obtained in, for example, orthopedics, plastic surgery, cardiac surgery, and recently also sports medicine. Recently, PRP facial injections can be added to the list of application areas where the rationale is anti-aging or skin rejuvenation. This slide represents a single platelet in which growth factors are stored. Following activation, these platelet growth factors are released and expelled to the surrounding tissues, where they meet their specific receptors on the cell membrane. There are a variety of devices on the market which can be used to prepare PRP. On this slide you see the Angel device from Cytomedics, which is a computer sensor-controlled automated centrifuge in order to sequester a unit of whole blood into platelet-poor plasma, red blood cells and platelet-rich plasma. The rationale for PRP therapies is the release of a variety of cytokines and at least 6 important platelet growth factors, which all have specific functions with regard to healing of tissues. Once growth factors have been released from the PRP, they will find their dedicated growth factor receptor. At this stage, intracellular activities will occur with ultimately the building of cellular structures. In this slide you clearly see the difference of a whole blood sample and PRP sample. Within the PRP sample a very high number of platelets and leukocytes when compared to the whole blood sample, indicating the efficacy of PRP collection with these centrifuges. In Angel's PRP you will have an increased white blood cell count, consisting of neutrophils, monocytes and lymphocytes, and they all have their specific function. Apart from their phagocytotic and immune response activities, these white blood cells are also known for their source of vascular endothelial growth factor, which contributes to angiogenesis. Furthermore, there is evidence that PRP with leukocytes, apart from healing properties, have an antimicrobial response against certain bacteria. In an in vitro study from Moyen, with a very high load of bacteria, it was concluded that PRP kills Staphylococcus aureus in less than 4 hours, demonstrating clearly the antimicrobial effects of PRP. Growth factor therapies have had the interest of surgeons in an attempt to modify and enhance the wound healing process. Under normal circumstances, platelets play key roles at almost all stages of the wound healing cascade. PRP will therefore boost the healing process. In the wound healing cascade of events, a variety of cells are active. Platelets are the first cells to be active in this cascade, where they initially build a platelet plaque and release their granular contents, including growth factors, therefore triggering the next series of events leading to healing. As mentioned earlier, PRP has recently been used as a patient's own autologous injectate for minimal invasive facial skin rejuvenation therapies to treat, for example, skin wrinkles and nasolabial folds. The technique is very similar to the injection of hyaluronic acid or Restylane or other skin fillers. Generally speaking, the indications for PRP skin rejuvenation are facial volumization, treatment of acne scars, a variety of wrinkles, nasolabial falls, or in combination with rhinoplasties. Recently, surgeons also use PRP in combination with fat for lipofilling purposes to increase the longevity of these grafts. With facial PRP injections, there is no need for the addition of thrombin in order to release the platelet growth factors. Tissue factor and collagen present in the dermal structures will initiate a slow platelet activation with a subsequent release of growth factors. Cordelli and Associates were one of the first to publish their results in a series of patients on face and neck revitalization using PRP injections. They performed the PRP injections in a similar way as they did with other filler injections. One of their conclusions was that face and neck revitalization with PRP is a promising, easy-to-use technique to improve skin texture, skin lines, skin elasticity, and the reduction in wrinkles, with high patient satisfaction of therapy. It is evident that collagen synthesis and type 1 collagen formation is crucial in skin rejuvenation therapies. From the literature it is clear that there is a dose-related relationship between the absolute number of platelets in the PRP and a significant effect on collagen formation. The PRP facial injectate should have at least a 3 to 4-fold increase of platelets compared to baseline whole blood values. PRP facial injections are safe to use and are an effective therapy in the treatment for skin rejuvenation, anti-aging, as demonstrated by a recent paper of Sclafani. To conclude, the advantages of autologous prepared PRP for facial injections include less encapsulation, granuloma formation, and chronic or delayed infections when compared to the temporarily resorbable fillers with less foreign body reactions.
Platelet-rich plasma is a component of whole blood that has been proposed for a variety of clinical applications, including chronic tendinitis, wound healing, cartilage or disc regeneration, and even cardiac applications. What we need to first understand is the basic science. In this short video, we'll go over some of that. Whole blood is composed of a variety of components, including red blood cells, a variety of white blood cells, and then tiny little fragments called platelets. These platelets typically are involved in physiologic function as a hemostatic sealant. In other words, they stop bleeding. They can also, however, be a scaffold for tissue regeneration, growth factor concentration, and even stem cell binding. So platelets have a variety of functions. In a peripheral blood smear, platelets can be seen scattered even at a high power infrequently. In platelet-rich plasma, however, the platelets can be seen much more often and in a much more concentrated amount. Now, why is this important? Well, that is in a resting state, platelets look spherical, but in an activated state, they spill a variety of molecules that are inside them called proteins that are also known as growth factors or cytokines. And these cytokines increase linearly with platelet concentration. What does that mean? It basically means that the more platelets you have, the more growth factors you have. And why are these growth factors important? Growth factors perform a variety of functions within your body. One is called chemotaxis, and that is directional movement in response to a chemical stimulus. So in other words, a cell can move in a particular direction. Stem cells can also be attracted to these growth factors and then migrate into the area. Proliferation, which is cell division in response to a stimulus, is another function of growth factors. And finally, platelet signaling. Growth factors bind to a cell membrane and can promote cell division. We'll go over some of the details of that. Now, what happens essentially is that on the cell membrane, there's a little receptor sticking out of the membrane that when that growth factor binds to that receptor then causes some intracellular changes, maybe even all the way down to the DNA level, producing different proteins or changing the function of that cell. That's how those growth factors work. Now, what are some of the growth factors seen in PRP? And there's a lot of different ones seen in PRP, and we're going to just go over really 3 of them now just for examples. One is PDGF, or platelet-derived growth factor, which is chemoattractive, meaning it attracts white blood cells and mesenchymal stem cells. Transforming growth factor beta, also known as TGF-beta, promotes cell mitosis. Mitosis is just another word for division or dividing. And it also significantly increases type 1 collagen production in tendons, and that was published a while ago and as a value when discussing the use of PRP for tendonitis. And then finally VEGF, or vascular endothelial growth factor, which stimulates angiogenesis or blood vessel formation. A paper was published a few years ago which shows that these 3, as well as a variety of others, significantly increase in concentration over whole blood in platelet-rich plasma. So PRP is a concentrated form of a variety of powerful growth factors. Now, how do you get PRP? There's a variety of different ways to do that. One of the simplest ways is seen and demonstrated here. You draw at about 55 cc's, and this is now can be as little as about 30 cc's of peripheral blood out of a vein, and this is just drawing it out of the elbow. Place that blood into a small little plastic canister and then put it into a centrifuge for about 15 minutes at 3,200 RPMs. You then remove the canister, and you can see that the blood now is separated into components. You remove the platelet-poor plasma, which is seen on top here in yellow. The platelet-rich plasma is trapped in this particular device in between 2 buoys, and then the packed red blood cells are seen in the bottom here. You shake this canister vigorously after removing the PPP for 30 seconds, and then what you do is remove the PRP, and this is what PRP looks like. Essentially looks like a little bit less dense form of blood, and you can see it in this particular picture right here. Now, again, what is PRP potentially used for? There's a variety of cell culture studies. There's published studies that support its use in chronic elbow tendinosis, wound healing, and that it's now being investigated for cartilage regeneration and even spine disc regeneration. This has been the basic science of platelet-rich plasma. My name is Dr. Alan Mishra, and for further information, again, visit the website at apexprp.com, apexprp.com, and in our next module, we will go over cell culture studies and platelet-rich plasma. Thank you for listening.